A well-made preliminary impression and subsequent preliminary cast are necessary in order to construct an accurate final impression tray. After positioning the patient with the chair upright, the head supported in the headrest, and the patient's mouth at the approximate level of the operator's elbow, we are ready to select the proper tray. The patient's present denture is a useful guide for selecting the proper size of tray to be used. The purpose of this tray is to carry, confine, and control the impression material, and therefore should be slightly oversized. The tray selected is always tried in the mouth to ensure adequate clearance on the peripheries and to determine where modifications may be needed in red utility wax. The maxillary tray is being modified in the post-dam area with red rope utility wax. When securing a preliminary impression in alginate of an edentulous mouth, it is advantageous to use slightly warmer water and in less amount than we would normally use for dentate patients. The differences in the water temperature and water-powder ratio will result in a stiffer mix that will set faster. The stiff material will better record the peripheries and soft tissue anatomical landmarks necessary for the impression. After mixing the material until smooth, the tray is loaded. Notice that very little of the mix is placed in the tray. A small amount of material is first wiped into the labial vestibule to avoid trapping of air. A cement spatula can also be used. The tray is then inserted and seated from the back to the front, which keeps the material from running down the soft palate. The buccal and labial flanges are border molded with slight manipulations of the cheeks and lips. The patient's head is steadied with the operator's arm, and the tray is held by the operator until the material is set. Setting time is lessened when warmer water is used. Never leave the patient unattended while an impression is setting in the mouth. After the material is set, the tray is removed. The patient's mouth is inspected to ensure that the airway is clear. The impression is next inspected to ensure that the landmarks and peripheries have been adequately recorded. The tuberosities and hamular knots should be identified bilaterally. The buccal and labial flanges should be identified bilaterally, and the buccal and labial frenuli should be visible. Often the fovea palatini are distinguishable at the posterior border. Material distal to the hamular notches and fovea can be removed. In order to preserve the accuracy of the impression prior to pouring in stone, it is covered with a wet paper towel.